I'm Dr. Carlos Rivas. I'm the son of an immigrant family from El Salvador. My family immigrated from there during the Civil War back in the late 70s, early 80s. I was born in California in the Bay Area. Grew up in the Bay Area, still living there right now. And, early on, going through my school years, going to college, I realized I really loved helping people. I wanted to help people take care of their problems. Just like I had some aptitude with some of the basic sciences, some of the hard sciences, biology as well. So in college, went to bioengineering, probably some of my influence from my dad, he's an engineer. And I liked the science aspect of it, I liked the biology, but I knew I needed to have more personal contact in my profession. So started leaning towards medicine. Got into the MD program at Georgetown, graduated from there. Had a good time, was really excited to start helping people with what I had learned in medical school. And so hit the ground running with residency, came back to California. But pretty quickly I realized that most of what we were doing in medicine wasn't really helping people long term. Of course, there's some great things about what you can do with conventional medicine, especially in places like the emergency department or the ICU. Like, people are literally on death's door and you can turn things around, you can save lives. But I was going into internal medicine and was already looking at, well, I want to help people in primary care, right? So long-term improvements in people's health. And I just saw that most of what we were doing didn't really deeply affect their health. It might control a symptom, might change some numbers like their blood pressure, might help them feel a little bit better in the short term, but long term, people's problem lists were increasing, their medication list was increasing, their complaints were increasing, and the only answer in our tool bag was like, well, why don't you try this other pill? Or, oh, maybe you need to see this other specialist, and just increasing the complication of intervention instead of really helping the patient get healthier. So, I had some other open-minded friends. We started having discussions about this, started reading more about, nutrition as medicine and other dietary and lifestyle interventions. I was super excited about those things. I was like, oh man, there's a gold mine. Diabetes, I can cure that with diet, was how I was feeling about things. So I started bringing some of those things into the clinic and residency. And really quickly I got negative feedback basically from my superiors in residency, hey, we don't have time for that. That's not what we do here. Leave that to the nutritionist. We got to go. Why don't you just add this other pill? Why did you take this medication off of this patient's list? They were doing fine on it. And I just realized, for all the good intentions that a lot of people in conventional medicine have, the system really isn't set up properly to help improve people's health, even when the doctors have really good intentions, or even when the doctors are really opening their minds and looking into other ways to help people. Yeah, so I had some really open-minded friends at the time. We started talking about, well, what are we going to do? How are we going to find a way to implement this? And so I started looking into well, how can I put together my own practice? Really quickly realized that I didn't have the business skills or the deep medical confidence in methods outside of what I had learned in conventional medical school and residency. So naturally started getting attracted to people who were, out there in the info space, all the podcasters and YouTubers who put out a lot of really good content. And I was soaking that stuff up like a sponge. I was like, okay, maybe with this, I can figure out, the pieces that I'm missing clinically and, start putting together some of the business stuff. But again, I found myself just spinning wheels on that, having a hard time getting started, having a hard time getting traction with any of those things, feeling clumsy with everything that I was doing. And then by chance, I saw Dr. Beck on a podcast episode with one of the guys that I'd been following at the time. And just his personality, his candor, you can just tell, even on a video that he's recording, how personable he is, how honest he is, that he means what he says, that his confidence isn't just like him puffing himself up, but it's coming from extensive clinical experience and like, consistent success with his clients. So reached out to him just like on a whim, didn't expect to get a response, or if anything, I thought like, he's going to send me some, email to click into his sales funnel, just like all the rest of them. But he immediately started interacting with me like personally, like, hey man, what's up? Like, how can I help? And I was, I had him like up here on a pedestal. I like couldn't believe that he was interacting with me at that level. But, had a really good rapport right away. So started working together. This was actually a few years ago when I first had this kind of personal interaction with Dr. Beck. And, he told me about his program. He was training practitioners to learn his method, and that we were going to hit the ground running with learning the business aspects that like, beginning to end, nose to tail. He was going to make sure that we had every piece of it working, so that we could practice confidently from a business perspective and a clinical perspective. And I was like, I'm sold, this is it. So started, I enrolled with him, started working through his program, learning his method, putting some of the business pieces together. But at the time, like my personal life was a complete mess. And that really exploded on me, actually. I won't get into all the gory details right now, but just like everything fell apart. And really at the end of the day, what happened was my confidence tanked so much that I didn't trust myself to keep going with Dr. Beck. I was like, I can't handle putting together my own business. I can't handle, the clients that he's sending me. And so like I actually pulled out of the program with Dr. Beck in a really bad way. I handled it really poorly. Like I stopped answering his phone calls, just like completely fell apart under the own weight of my own like disappointment in myself. And so actually years went by, and like while that happened, Dr. Beck's voice kept coming back into my head, little clinical pearls, and really even more than anything else, like personal insights, like how to change my mindset about facing my problems, or, like why people tend to do certain things and why it's so hard to get people out of those patterns. Not to mention, watching the news, things that were happening like on a public health level, et cetera, et cetera. And so like little by little, like, the voice of Dr. Beck in my head just like kept ringing. It was like, in ways, like I say, I went around the world looking to see if somebody else had put together things at such a high level as Dr. Beck, and I couldn't find it. I spoke with other mentors who, probably I started talking to them just because they didn't believe in me the way that Dr. Beck believed in me, so they didn't hold me to the same standard. Because they didn't hold me to that standard, I didn't feel like, man, it's so crazy. Like, because I believed in myself so little at the time, that I didn't realize what I was capable of. So when people lowered the bar, I felt more comfortable. And so I didn't, it took me a while to realize this, but because I was afraid to get out of my comfort zone, that was really the main reason why I fell off with Dr. Beck. But his belief in me and the wisdom that he had shared with me, even in the little time that we originally worked together, just reinforced with me over and over again that nobody else has put the system together as comprehensively and as consistently as he has. So what really put the nail in the coffin as far as like no other program making sense to me, and no other mentor having the same level of credibility as him, was actually with all this COVID stuff. That everything I was reading and hearing about it didn't make sense. I didn't know what all the like right answers were about how to guide patients actually through what we were experiencing at the beginning of the COVID pandemic. But then Dr. Beck started putting out content about it and helping us to understand what was really going on, and boldly announcing his understanding of what was going on, even though it was 100% against the mainstream narratives. And like, I was like, what he's saying makes sense. Why is he the only person in the world that I've seen who's knowledgeable enough and courageous enough to just come out with what makes sense, with this terrible, terrible situation that we're all going through. And so and I also had a buddy of mine who was also connecting with Dr. Beck, and we were talking about how Dr. Beck was the only one making any sense. And he reminded me, he was like, hey man, why don't you reach out to Dr. Beck, get started with him again? And that little worm got in my brain. I reached out to Dr. Beck. I was like, hey man, I'm sorry about how I handled things back in the day. Letting go of the program and working with you. But I need help and I want to get back to the kind of practice that I dreamed about when I was working with you originally. And just that's when Dr. Beck's heart just melt, I don't know how to say it, melt in my soul, because he's just such a good man. He's like, I forgive you, I understand. We all go through hard times. There's a reason for what you went through. You're going to be able to help other people because of all the ups and downs. Let's do it. And I was like, all right, let's do it. And I just had no doubt in my mind at that point that what Dr. Beck has to offer was the way that I needed to practice both professionally, clinically, and actually he's helped me a lot in setting my head right about my own personal life. So still have a long way to go with improving all these things, but I have no doubt that I'm on the right track. Nice. It's been excellent because for any physician who's been after medical school, after residency, especially if you're pretty early on in your profession, everybody's loaded with student loans and actually has a pretty challenging financial situation. Everybody thinks oh, doctors, they're just made of money. They drive nice cars, they have nice houses, and a lot of them do. But what most people don't know is behind the scenes, they're loaded with debt. So it's not easy for a doctor to just sign up for another program and have to pay out a ton of money and not know when they're going to start being able to see clients under that new framework. For an example, it might be IFM. It could take you, let's say a year and a half to get fully certified and then start seeing patients, as a functional medicine practitioner, who has all the money and all that time before they can start seeing patients. So, Dr. Beck, right off the bat, he's like, okay, let's get started on your business, start getting clients coming in, and you'll learn the clinical practice of it as you go. And so that made perfect sense to me. I need to have clients coming in to fund the program, improve my own financial situation. And then in that way, it's also kind of like medical residency where you're learning with the cases as they're coming in. And there's no qualms about is there going to be a problem if I don't know all the material that I need to know in order to take care of my patient properly? Dr. Beck's backing us up 100%. So we just have to follow the recommendations that he's giving as far as how to get the business set up and how to start attracting the right kind of clients, and the rest all takes care of itself. If all the good stuff that's in all the other approaches, Dr. Beck has looked at it, he's evaluated it, he's integrated the parts of it that are useful. He's made sure that those are anchored in solid principles that have been tested through the sands of time, and shed all of the other fluff, all the things that are easy to get confused on, or the things that are not necessarily clinically applicable. We make sure we get down to the foundation of things, the things that are most important for really helping people quickly and substantially improving their health rather than just mitigating symptoms. So, I'm more than sold. Yeah, so, my principal goals are consistently getting the patient flow that I need to meet my financial goals. And then, really, because the system is so robust, that's all I'm concerned about. Because I know that as long as I'm bringing patients in and I'm sticking to Dr. Beck's recommendations in the preceptorship program, that all the rest is going to come with it. You know, as we review cases, we'll have that repetition and re-explanation of the clinical material that I might not feel 100% on. It's like, okay, I have a vague idea what's going on here, but I'm not totally solid on it. I know that when I see this, we've been doing this kind of response to it, but I still don't, you know, I don't have it memorized by heart yet. You know, I don't have a full confident grasp. Well, no worries. On the next client, we'll see it again. You know, after 5 clients, I'll have seen it a number of times. Yeah, you know, those pieces will be taken care of as we go. So, you know, my main goal is just to have the consistent client flow so that, you know, I can financially have the things that I need in place for myself, for my family, and to continue to invest in the business. And, you know, the rest will take care of itself. No, if you are thinking about Dr. Beck's program, don't make the mistake I did. Don't hesitate. Don't wait. Don't say, oh, I need to do my research and see what else is out there. Dr. Beck's program is it. Balanced protocol is it. I wasted years and so much money and just like, you know, difficulty in my life not following the recommendations and advice that Dr. Beck had put out there for me initially. So if I could do any of that again, I would just say, you know, put all my faith in what's right here in front of me. It will work, even if for things that I don't understand or things that I have difficulty with, or even things that I think like Dr. Beck might be mistaken on. What you cannot question is Dr. Beck's commitment to you and your success. So even if there are a lot of roadblocks, a lot of problems, a lot of things that you're not sure how you're going to overcome, through the Balanced Protocol preceptorship, you will find solutions as long as you stay committed. So don't make the same mistake I did. Stick to your guns. Go in, dive in head first, and you know, whatever difficulties you may have, just stay committed. It'll work out.